What are the 9 reasons you can have acid reflux? You can have a weak valve at the bottom of your esophagus. You could have a hiatal hernia. You can have slowed stomach emptying. You can also have too little stomach acid. You can have a poor diet. You can have obesity, especially around the midsection. You can have vagus nerve dysfunction. We're going to go into all of these. A high stress level and or a microbiome imbalance. So your microbiome is the 60 to 100 trillion organisms making up your colon. And when you have too many bad guys versus good guys, that creates a lot of issue. Okay, so let's start at the top though. So we have acid reflux. And if you do, you're in very good company with millions and millions of Americans and people around the world. But what are you told to do? You're told to take an antacid. And these antacids have a lot of dangerous side effects. I've done several videos on those, but just to hit the highlights, they increase your risk of infection, osteoporosis, dementia, kidney disease, heart disease, stomach cancer, and the list is longer. So these are not drugs to just take and think they're safe, because they're not. These side effects are very, very well documented. So what are our options? Now, starting at the top, we talked about a weak valve. It's also called a sphincter. And your digestive tract is very reliant upon valves, and it's a pressure system actually. So when you swallow, you can feel that pressure, right? It's if things are going down, and there's only one good direction that your gut should be moving in: top down, right? So we want food and drink to go down. We don't want it to come back up. That's vomiting or acid reflux. So these valves, or sphincters that they're called, you've got 2 in your esophagus. You've got one at the level of your diaphragm. They're in your stomach, your gallbladder, your pancreas, your colon, and it's all about the pressure of sensing something is coming, food is coming, drink is coming, or digested food is coming lower down, and they open when they sense it, and then they close. And with the closure is some pressure down, keeping everything moving in the right direction at the right speed. Also, there's a speed of how the gut works. So a lot of times with acid reflux, with hiatal hernia, you're told you have this weak LES, lower esophageal sphincter. And yes, it's gotten weakened, but why? So there's been pressure of the stomach contracting, and also your abdomen having a lot of, it's all pressure based, and that pressure is pushing up. So the sphincter can weaken over time. Now, there's varying degrees of discussion about, can you get the tone of the sphincter back? So you can just think of like a muscle being well-toned versus flabby. So we want well-toned sphincters, and there's some research that says yes, it can regain some function. Other research says no. But the way we see it here at the clinic, because we see thousands of patients with hiatal hernia and acid reflux who do very well and revert, it's also a combination of getting all the valves to work really well, because the human body is brilliant in its redundancy, meaning it's got backup systems. So you've got that lower sphincter, but then of the esophagus, which is just above your stomach, but just above it, you have your diaphragm, that dome-like structure that, when you're breathing, is going up and down. It acts as a sphincter too. So, and they're very close to one another. So if you can get the diaphragm working really well, its sphincter working well, then it can act as a nice backup to this lower esophageal sphincter. So it's about regaining tone and regaining balance, and the body does love to heal, and there's plenty of evidence that it does to a degree. And you don't need 100%, you just need enough improvement that you're not suffering with symptoms. So if you've heard, oh, you got a weak LES and your only solution is to have surgery, that's not necessarily the case. And you want to do your due diligence looking into surgery, looking at its repercussions and the potential negative side effects, and the fact that it does have a failure rate of up to 40%, depending on the surgery and depending on the length of time, but a pretty high failure rate. Okay, so then getting on to hiatal hernia, which we talk a lot about in this channel. And with a hiatal hernia, your stomach is above the diaphragm. And we just talked about the diaphragm acting as a valve, right? Acting as a sphincter. So of course, as soon as the stomach comes above it, we've lost that degree of pressure pushing things down. And now the LES, that lower esophageal sphincter, that's been breached. So no wonder with a hiatal hernia, you're getting reflux. But the hiatal hernia can relax, it can come back down, meaning that the stomach that is being pressed upon, there's spasm in that stomach and it's being forced up. When we get that pressure to abate, the stomach relaxes, the diaphragm relaxes, and that's how we also get reversal of symptoms. All right. Then you've got slowed stomach emptying. Now there's a variety of things that can cause this. We're going to talk about the vagus nerve. That can cause it. The decreased stomach acid, which is my next topic, can cause that. The microbiome imbalance, which is also on this list, and chronic stress, which is on this list, and then also diabetes. So due to neuropathy or nerve damage, you can get slowed stomach emptying. But generally speaking, the slowed stomach emptying is happening from the other factors that are on this list of why you're getting acid reflux. So they're all pretty interrelated and they rely upon one another, which is why there's not a single thing to do. You have to evaluate the person, evaluate your body and see what factors make sense that are contributing to this and handle all of those that you can find, because they do act synergistically. So let's say the vagus nerve, which is your longest cranial nerve, comes out of your brain, travels down the front of your neck, and goes to every digestive organ in addition to your heart and your diaphragm. So it's very intimately associated with the symptoms of hiatal hernia syndrome, where you have heart palpitations and shortness of breath and anxiety, which ties into the diaphragm function. So with the vagus nerve being inflamed or not of the proper tone, then you can get this slowed gastric emptying. But again, it also feeds into what the heart is doing and what your diaphragm is doing. And so normalizing vagus function, as long as it hasn't been damaged in surgery, then the tone can be restored naturally. There's vagus nerve exercises we do. There are certain devices that improve vagal tone, and all of these are natural. They're non-drug. Okay, so then we go into low stomach acid. And now, how do you get low stomach acid? Because when you have acid reflux, it feels like I've got too much. And it's interesting how you can have low stomach acid, not enough, and still get the symptoms of acid reflux. And that's because that sphincter we were talking about, it needs acid to cause it to close tightly and keep that pressure going down. So if you have low acid, which can come about from being on a PPI medication, of course, because that's its job, is to decrease your acid, but also just the passage of time, being under a lot of stress. And the stress connection goes back to our vagus nerve and any of these factors, but just getting older, we tend to make less acid actually. So it's so interesting how many older people are on PPI medication and they very well could have low stomach acid due to their age, but they still have the symptoms, that feeling, and they're not hallucinating the feeling. It's a real feeling that they have, but that there's enough acid that due to the lack of the sphincter control and due to also imbalance of their gut, there's enough acid coming up into their esophagus to still give them that sensation. But it's not too much acid, and unfortunately being on an acid reducing medication is going to make the problem worse, not better. So this all has to be evaluated. Are you in this category or not? Okay, then our favorite poor eating habits, which we excel at in this country, but eating late, overeating, eating very fatty foods, big fatty meal, it's too large, you're eating and then going to bed, you're not waiting the 3 hours and actually walking off the meal a little bit. And this is not jogging after dinner, but this is if dinner is your largest meal, but movement and a stroll after dinner would help a lot. But we have the poor eating habits. We have the heavily processed foods. We have non-foods, meaning, they're packaged. There's a lot of chemicals in them. They're not real whole foods. So that's the poor eating habits that we have as Americans, not to mention the certain types of foods that aggravate once you already have acid reflux. And they're aggravators, these foods. They're not causative. More causative, interestingly enough, is we have the functions of the gut, and we've talked about some of those, but also having food sensitivities can be a causative factor. And when you're looking at food sensitivities, things like gluten and dairy are two of the most common foods, and they're not acidic foods. As a matter of fact, those are the foods that people are told to eat to calm their stomach, right? Have a piece of bread, drink a glass of milk. And again, that's fine if you're not sensitive, but if you are, that's actually causing the problem. So there's the dietary factor. Then we have another big problem for Americans is obesity, and especially in the center. It's called central adiposity. Adiposity is just fat. So you have the fat around your midsection, which is the unhealthy fat because it permeates into organs, and you get fatty infiltration of the liver and various organs, and that creates a lot of pressure in your abdomen. And again, we've been talking about pressures, right? And the pressure of the normal digestion is pushing everything top down. But if you get that pressure in the abdomen, it's forcing things back up, and that's creating the reflux. So working on that. So these are things that are all correctable, and we can work with that. Okay, and then we get into stress. So where stress fits in, stress is a trigger to make everything worse, frankly, but it really fits into the vagus nerve, because the vagus nerve, you've heard about your fight or flight. Everybody knows about the fight or flight part of their nervous system. That's your sympathetic nervous system. But its twin, its counterpart is the parasympathetic nervous system, which is for rest and digest and relax. And the vagus runs that part of your nervous system. So they play with each other, right? There's an interface. I'm doing a video right now, so I'm a little excited, so I'm a little more in fight or flight, and then I'll be done with that, and then I'll get into my parasympathetic and relax. So they're supposed to be, interacting with each other appropriately. So if you're sitting at your desk right now listening to me, or you're in your car and you're feeling a little anxious, and there's, you don't want to be all, into fight or flight, that's inappropriate, right? So that's where the vagus nerve comes in. If the vagus nerve is malfunctioning, then you're not getting into the parasympathetic rest, digest, relax, and you're just too stressed all the time. You're constantly in fight or flight. I meet patients like that all the time. They're like, I'm just constantly in fight or flight. It's awful. It's draining. I can't sleep well. I'm stressed. I'm anxious. And it's not a good feeling. But it's correctable with vagus nerve rebalancing, also hormone rebalancing. So those are the things we can do. And last but certainly not least is our microbiome dysfunction or imbalance. So again, that's your 60 to 100 trillion organisms, microbes, bacteria in your colon that are critical for gut health. And when you have a lot of good guys, then your digestion is great. You've got low inflammation, your hormones are balanced, the gut-brain connection is working well, you've got good cognition, all of those good things are happening. But with acid reflux, we tend to get an imbalance of those microbes, more bad guys. And again, they're creating generalized inflammation, they're creating pressure. A lot of times constipation can go with that, or diarrhea, one extreme or the other, but not normal gut function. And also stressful for the vagus. So all of these things are tied together. So those are the 9 reasons. And you see, it was hard to make that super short. So I hope you're still hanging in there with me, because the important thing is that these things are correctable naturally. And I talked about the valve and how much we can come back from malfunction with that. But certainly what we see with hiatal hernia, same thing. We get enough relaxation, we get that diaphragm functioning the way it should, and we don't have to have that stomach, pushing up. Now, I'm not talking about a large hiatal hernia. That's different. That's where surgery comes in. But the majority of them are small to medium. 95% of these hiatal hernias are sliding, which means the stomach pushes up and it goes back down. It pushes up and it goes back down. So you see, if you take away the pressure pushing up, then it stays down, right? It makes sense. And that's what we see with our patients. The low stomach acid is easy to treat. You just have to make sure that that's the cause. So we don't want to create a lot of burning if that's not the cause, but that's an easy test of hydrochloric acid, or even playing with apple cider vinegar and see how you do with that. I'm not prescribing for you, but you can trial that, talk to your doctor, and see, do you have low stomach acid or not? Because if you do, then a PPI is doing you no good. Then we go into dietary factors, and what we want to do is get you on a real whole food type diet. And there are nuances for that depending on any food sensitivities that we figure out that you might have. But it's going away from the ultra processed, the highly packaged, high sugar foods, and getting into real foods. And again, there's help and hand-holding that goes along with that, but that's not difficult. And then, of course, losing weight is something that tends to go along with just getting healthier. We were talking about a gentleman this morning who'd gone down 4 inches, in his pant size in just several weeks. And that's a little bit the male population versus us on the female side, where men can lose weight faster, especially when they clean up their diet and get rid of inflammation. But this is something we specialize in, and it's all part of the overall health focus. Is you can't have a lot of obesity and think that you're not going to have acid reflux or hiatal hernia, because that pressures. If it's in the abdomen, I'm talking about abdominal weight, not maybe because your thighs or buttock is larger than you want, but specifically central adiposity in that central section. And then we have our microbiome. So testing your microbiome and seeing good bacteria, bad bacteria, what rebalancing needs to occur. So it's a synergy of all of these things. And I know this has been a lot, but that's what has to occur in order to handle acid reflux for good. And along with that goes hiatal hernia, because hiatal hernia and acid reflux go together about 70 to 100% of the time. So you're in very good company if you're suffering from acid reflux, but you don't need to continue to suffer. There's a lot of things we can do, and it's tailored to you, to figure out what are the root causes for you. So if you enjoyed this video, and I hope you did, then please consider subscribing to the channel, comment. I love comments. I answer all of them, and give it a thumbs up and share it with somebody you know who's also suffering with this. We'll talk soon.